Good morning, USA, and good evening, India. Namaste. I am Dr. Ritika Shah, and I would like to welcome you all to the GCAR Journal Club March meeting. Journal Club is an educational initiative by GCAR where we discuss published research, articles, and critical analysis to stay updated with latest research and promote evidence-based Ayurveda. GCAR, or Global Council for Ayurveda Research, is an international non-profit organization based out of USA with a sister chapter in India by the name of Ayurveda Anusandhan Abhiyan Foundation, AAAF. Let me share you a short glimpse of it. Just a minute, I'm trying to find the website. I can't find it. So, our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please consider joining us as a member, which will bring you access to all our resources and to non-profit, and no nonprofit can cooperate and succeed without volunteers. So consider joining us as a volunteer, and we can place you in a variety of projects based on your skills and interests. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce you to our eminent speaker, Dr. Supriya Kurane Singh. Dr. Supriya has done her graduation and BAMS from Bhai Sahib Sawant Ayurveda Medical College, Sawantwadi, Maharashtra, and she has done her post-graduation in Shalya Tantra Ayurveda Surgery from R.A. Poddar Ayurveda Medical College, Mumbai. She has also done her PG diploma in clinical research and pharmacovigilance from Mumbai. She has 12 years of clinical experience and has worked on Ayurveda research projects at some renowned institutes like CCRAS and Topiwala National Medical College, Mumbai. She has 10 international publications in her name. Currently, she is working as a consultant and assistant professor in an Ayurveda Medical College at Bhopal, India. She works as a senior Ayurveda consultant and Ayurveda tutor on an international platform accessible to more than 8 countries. Thank you, Supriya, Dr. Supriya, for joining us. Over to you.
Oh, thank you so much, Dr. Ritika, for the introduction and kind words. So we will start with my presentation.
Yes, we'll start with the presentation.
Okay. Is it visible?
Yes, we can see it.
So we can start.
Yeah, please start.
Okay, thank you. First, I would like to thank and show my gratitude to Global Council for Ayurveda Research for having me on March 2024's Journal Club meeting. So today we are going to discuss a research paper. The title is Clinical Evaluation of Yoshadi Gugur and Panchasama Churna in the Management of Rheumatoid Arthritis, an open label, single arm prospective study. First, I'll just read out the disclaimer. This presentation is for academic purpose to understand methods for critically appraising a scientific manuscript. It by no means intend to harm or criticize the investigators or any other personnel connected to the manuscript or clinical study. The views expressed herewith are with sole purpose to be academic. The presenter declares no conflict of interest. So the title of today's article that we are going to discuss is Clinical Evaluation of Yoshadi Gugur and Panchasama Churna in the Management of Rheumatoid Arthritis. Okay, it is an open label, single arm and prospective study. So as we all know that rheumatoid arthritis is a chronic systemic autoimmune disease, and it is the global prevalence of RA, rheumatoid arthritis worldwide, is estimated to be around 0.24% based on the Global Burden of Disease 2010 study. Another study shows that 460 per 1 lakh people in the world are suffering with this disease. The common symptoms are joint pain, joint stiffness, and with chronicity, there is disability. There is symmetrical, articular, and extra-articular symptoms. And along with, there is involvement of skin, mucosa, heart, lungs, and eyes. So there are some general symptoms also like fatigue, weight loss, sweating, paresthesia, transient muscle pain, etc. So as this is a chronic disease, there is also a risk of developing several adverse long-term outcomes, such as physical and work disability, reduced quality of life, susceptibility to developing other chronic diseases, and even premature mortality. So, according to Ayurveda, you can correlate Amvat with the rheumatoid arthritis. So, in this disease, in Amvat, okay, there are two words, Ama and Vata. So, there is accumulation of Ama in joints, along with there is vitiation of Vata dosha. Ama localized in the body tissues and joints in association of Vata aggravation. Okay, it results in the manifestation of joint clinical symptoms, such as some local symptoms, such as pain, stiffness, swelling, and joint tenderness, and some generalized features, such as fever, malaise, anorexia, heaviness in the body, and body ache. So, Ayurvedic principle of management of Amvat includes balancing the aggravated Vata dosha and improving Jataragni, that is digestive fire, to alleviate or remove the Ama. So, that is the basic understanding of rheumatoid arthritis and Amvat. Now, let's see in this particular paper the aims and objectives. The primary objective of this study was to evaluate the effect of Yoshadi Gugur and Panchasama Churna. These are two Ayurvedic formulations in managing rheumatoid arthritis through parameters such as disease activity score 28, RA factor, erythrocyte sedimentation rate, that is ESR, and C-reactive protein, CRP. And the secondary objective of the study was to demonstrate the clinical safety of Yoshadi Gugur and Panchasama Churna. Now let's see the materials and methods. The study design It was an open label, single arm. Okay, there was no comparator, and a prospective clinical study. The study site was at the CCRS Institute, Central Ayurveda Research Institute, Bhubaneswar. And this study was ethics approval. For this study, the ethics approval was obtained from the Institutional Ethics Committee, and study was registered in the Clinical Trial Registry of India. In this study, the sample size was 90, and selection of participants was done from October 2015 to February 2018. And this paper is actually published in the Journal of Research in Ayurvedic Sciences in December 2023. The duration of the study was 12 weeks, and there was follow-up every 2 weeks. Now let's see what are the inclusion criteria in this study. So either gender subjects were included, age between 20 to 60 years, and participants, those willing to give written informed consent to participate in the study. Then presence of 4 or more out of the 7 criteria mentioned below. Okay, so that was the inclusion criteria, which included morning stiffness in and around joints, arthritis of 3 or more joints, or at least 3 joint areas, having pain with soft tissue swelling or joint effusion, not just the bony overgrowth. Then third criteria was arthritis of hand joints, at least one area in the wrist and swollen hand. Then symmetrical arthritis. Then presence of rheumatoid nodules, which are generally seen on the extensor surface of the limbs and pressure bearing areas such as elbow. Then serum RA factor positive, and typical radiographic changes of arthritis on PA view of hand and wrist joint that must include erosions or unequivocal bony decalcification localized in or adjacent to the involved joints. So from these 7 criteria, presence of at least 4 criteria, those patients were included in the study. Now let's see the exclusion criteria. So the participants who had complications of RA, okay, like deformity of joints or bones, then pleural or pericardial disease, those who are unable to walk without support or confined to wheelchair, those were excluded from the study. Then patients with poorly controlled hypertension or diabetes mellitus, okay, those were also excluded. Then other types of arthritis, okay, other than RA, such as gouty arthritis, tuberculous arthritis, they were excluded. Then prolonged, that is more than 6 weeks of medication with corticosteroids, antidepressants, anticholinergics, or drugs such as anti-inflammatory analgesics that may have an influence on the outcome of the study. Okay, they were excluded from the study. Then participants or patients with the history of atrial fibrillation or acute coronary syndrome, myocardial infarction, stroke, severe arrhythmia in last 6 months, and symptomatic patients with clinical evidence of heart failure. Then concurrent serious hepatic disorder with AST and ALT and total bilirubin, alkaline, which is more than, alkaline phosphatase, which is more than 2 times its upper normal limit. Okay, they were excluded. Then patients with renal disorder, okay, serum creatinine more than 1.2 mg per dl, or severe pulmonary dysfunction with uncontrolled bronchial asthma or COPD. Then patients who are alcoholic or drug abusers or patients having past history of hypersensitivity to any of the trial drugs or its ingredients, they were excluded. Then pregnant and lactating women and participants who have completed participation in any other clinical trial 6 months prior to this study, they were also excluded from the study. Then the withdrawal criteria. Development of any serious adverse effect which necessitates hospitalization. Okay, such participants were withdrawn, and non-compliance to the treatment regimen. Minimum of 80% compliance was essential, and those patients with less than 80% compliance were withdrawn from the study. So from 90 sample size of the study, in this study, one participant was excluded, withdrawn because of the non-compliance to the treatment regimen, and so that the results are calculated for the 89 participants. Now the study intervention. So basically there are two Ayurvedic formulations. One is Vyoshadi Gugur. The dose is 1.5 gram, that is 3 tablets of 500 mg each. Okay, twice daily after food with lukewarm water. Then second is Panchasama Churna, 3 gram twice daily after food with lukewarm water. And this intervention was for 84 days, that is 12 weeks, to all the participants. Now let's see the outcome measures. The primary outcome measures were to assess changes in the DAS, that is Disease Activity Score 28, okay, from baseline to the end of the treatment. So this DAS 28 score includes number of painful joints out of the 28 major joints, then number of swollen joints, and ESR. Okay, these are the three factors which are considered here. Then secondary outcome measures were to assess changes in disability index score, then to assess changes in acute phase reactants such as ESR, CRP, C-reactive protein, and health questionnaire short form SF36 score from baseline to the end of the treatment. And another secondary outcome measure was to assess safety based on the onset of adverse events. So this is a timeline of the participants. So at the screening visit, okay, there was the patients were checked for eligibility according to the inclusion and exclusion criteria. Then informed consent was taken, physical examination and lab investigations were done in the screening visit. And when when the patient is eligible, then the patient, then on the baseline visit, okay, during selection, patient's identification and demographic profiling was filled. Then the medical history, general physical and systemic examination was done. Ayurvedic parameters were done. Then the different questionnaires, okay, the SF36, DS28, and disability index, those were filled. Then issue of trial medicine and drug compliance report form was given to the patient, and patient was instructed to visit after 14 days because there was follow-up on every 2 weeks. Okay, then that was the baseline visit. Then on the intermediate visits, that is at every 2-week gap, the assessment of medicine compliance was done. Okay, then collection of compliance report, then used containers, and you tally the medicines consumed by the patient. Then assessment of clinical parameters such as these DS28 and disability index and general examination. Then assessment of adverse drug reaction, then concomitant and rescue medication, if any. Then at every intermediate visit, Okay, ESR and C reactive protein were done. The blood test was done. Then issue of trial medicine and drug compliance report. And then patient was instructed to visit every for next 14 days, after next 14 days. And so these were the intermediate visits, that is follow-up visits. And the last visit, that is 84th day. On this day, the again the medicine compliance and collection of compliance report and used containers was done. Then laboratory investigations. Okay, all the laboratory investigations were done except the X-ray, and the different questionnaires were filled, and patient was assessed for any ADR. So that was the timeline of the participants. Now the laboratory investigations. At baseline, these investigations were done. Okay, the liver function test, renal function test, complete blood count, serum uric acid, erythrocyte sedimentation rate, that is ESR, hemoglobin, fasting blood sugar, ASO titer, CRP, RA factor, ECG, X-ray of PA view of both hands. So because with these laboratory investigations and X-rays, they will come to know about the inclusion, whether the patient is eligible for the study. Then at each follow-up visit, ESR and CRP were done. And on the last visit, again, all the investigations were repeated, just excluding the X-ray. Then statistical methods. Descriptive statistics have been used to analyze the results. Continuous data such as age were presented as mean plus minus standard deviation, and categorical data is represented as frequency and percentage. Then paired t-test has been used to compare the outcomes from baseline day to 84th day. And a p-value of less than 0.05 has been considered significant. So now let's see the results of the study. First, the demographic profile of study participants. The maximum number of participants were found to be females. Okay, that is 93.3%. So as we know that RA is more commonly seen in females. So this is proven here in this study. Then 72% were middle-aged participants, that is 31 to 50 years of age. Then disturbed sleep pattern was reported in 44% of subjects, and irregular bowel habits were reported in 51% of participants, highlighting here the problem with indigestion. About 70% of the participants had an average level of emotional stress. Then let's see the effect of trial drugs on the outcome parameters. So the DAS28, okay, disease activity score, and ESR were significantly improved from baseline to 84th day. And whereas only a slight reduction in CRP was observed, which was statistically non-significant. Then significant improvement in the change in disability index score and change in all the domains of SF36 were observed. So basically, the SF36 and like disability index, it is it suggests how the person is able to or not able to do the daily activities of his or her life. And SF36 includes a lot of things, and also assesses the disability of a person, how the disease is affecting the overall being of the person. So significant improvement was observed in disability index score and domains of SF36. Then slight changes in biomarkers such as ASO titer and RA factor from baseline to 84th day were reported were reported, though it were statistically insignificant. Then let's see the effect of therapy on clinical symptoms as per Ayurveda. Okay, so the Ayurvedic symptoms uh, which are present in individual in the patient are generally the body pain, anorexia, raised body temperature, heaviness in the body, indigestion, swelling, lethargy, loss of interest, disturbed sleep, constipation, and joint swelling. So all of these symptoms were reduced in more than 75% subjects after completion of the trial. And 28% of subjects got complete relief from Sandhi Ruja, that is joint pain, at the end of the 84 days. So 95.55% of participants got relief from fever, 84.3% of participants got relief from malaise. Then morning stiffness was reduced in 79.85% of participants, and joint swelling was reduced in 68.5% of the participants. The symptomatic improvement was recorded in clinical symptoms of RA, such as tenderness, joint pain. Now let's see the effect of therapy on the laboratory investigations and safety parameters. So almost all the parameters, okay, LFT, RFT, CBC, were within the reference range during the study. And there was a significant reduction in fasting blood sugar from baseline to the 84th day after the treatment. And there were no any ADRs or adverse events reported during the study. Now let's see the discussion. So as we know that this is an autoimmune disease, rheumatoid arthritis, which is considered some causes which are considered some causes for the autoimmune diseases are considered to be bacteria or toxins, viruses, certain germs and parasites, certain fungi, drugs, chemical irritants, environmental irritants, or sometimes hereditary. And the common symptoms of all the autoimmune diseases are like low-grade fever is present, then rashes on the skin, tingling and numbness in the arms and feet, then fatigue, swelling and redness, hair loss, muscle ache, difficulty in concentration. So depending upon the affected area of the body, okay, different autoimmune diseases are seen, like atopic dermatitis or Addison's disease or rheumatoid arthritis or psoriasis. So there are so many autoimmune diseases, and these disorders not easy to treat. And autoimmune diseases can be frustrating, uncomfortable, and even debilitating. Though we don't know the exact triggering factors for this overactivity of the immune system, the common suspected causes are like genetics and infection that we discussed. And Western diets, which contain high sugar, high fats, and processed foods, are considered as risk factors for the autoimmune diseases. Ayurveda suggests that the immune system does not accidentally attack the body's own cells, okay, but it does it to defend against a form of harmful metabolite in the body that is called as armor. So armor is produced in the tissues that are attacked by the autoimmune that are attacked by the person's own immunity, the immune cells, the WBCs. So poor treatment of the disease and repeated suppression of symptoms without addressing the cause, it accelerates the disease progression. So according to Ayurveda, autoimmune disorders can be treated by drugs, that is herbs, diet, or even lifestyle modification. The treatment regimen commonly includes Shodhan, Shaman, and Rasayan Chikitsa. And these measures act by one of these ways. One, acting at the level of Rasadhatu, thus directly improving the quality of nutrition. Then acting at the level of Agni, that is by improving the digestion and metabolism of the body, and thereby affording the better nutrition. And third is acting at the level of Strotas. By improving the microcirculation, it ensures the proper perfusion and nourishment of the tissues. So there is armor. Now let's see what is armor. So armor is present, is seen in autoimmune diseases, and certain characteristics of armor when is present in our body are seen in these diseases, such as Strotarod or obstruction of the channels, loss of strength, heaviness in the body, or constipation, anorexia, etc. And the inflammation is caused by lack of cellular recognition or communication. And this breakdown of communication is due to cells being covered with something or having some component with bad behavior. And ama or ama dosha is considered a reason for this inflammation. So arm can be treated in different ways. The most important is the apatarpan. The langan is done. There are different types of apatarpan, langan pachan, and shodhan. Then after shodhan chikitsa, okay, certain pathya and apathya, that is, certain dietary guidelines and daily routine changes are advised, which help in the metabolic correction and formation of new tissues by enhancing the agni. Medicines like gugul and haritaki promote systemic nutrition by the way of strotoprasadan or strotoshodhan. Okay, so the lekhan action, which is intended to remove the toxins, that is armor, from the body. And then such medicines act as rasayan also. So after the shodhan and deepan pachan, certain herbs and foods which act as rasayan, that is, they improve the the body improve the quality of the body constituents, improve the metabolic process. Okay, so these rasayan herbs are also advised in this type of diseases like tulsi, brahmi, shatavari, guduchi, etc. So here in this study, the two herbs, the two medicines that are used, Vyoshadi Guggur and Panchasama Churna. The Vyoshadi Guggur includes the ingredients of Vyoshadi Guggur are Triphala, Trikatu, Chitrak, Musta, and Vidanga. And in Panchasama Churna, the ingredients are Shunthi, Haritaki, Pippali, Trivrutta, and Sovarchal Lavan, that is black salt. So the ingredients of Vyoshadi Guggur, okay, they have Katu and Tikta Rasa, Ushna Virya, and they have Rasayan, Ampachan, and Vata Shamak properties, okay, so which help to disrupt the pathogenesis of Amvat. Similarly, the Panchasama Churna, its ingredients also have Deepan, Pachan, Anuloman, Amadoshahar, Vata Kafahara, Ridya, then Shula Prashman, that is relieving pain, Rasayan, and Jwaragna properties, thereby reducing the symptoms of anorexia, fever, heaviness in the body, swelling in the joints, and stiffness in the pericardial region. Further, the gugul, which is another important ingredient in which acts like a base in Vyoshadi Gugul, is considered the best drug for alleviating Vata rogas. Various research studies have shown that the anti-arthritic activity of Gugul, Shunthi, and Pippali is beneficial in managing Amvat. So these herbs, okay, Triphala, Gugul, Shunthi, they consist of cabulic acid, gugulsterone, and gingerol. Okay, they are known or they have shown properties in various clinical studies is to suppress the inflammatory mediators like TNF alpha, interleukin 1 beta, and interleukin 6. The gugulsterone, which is present in gugul, reduces the level of pro-inflammatory cytokines, cyclooxygenase 2, messenger, ribonucleic acid, and suppresses its TNF alpha mediator induction and its activation, and thereby acting as anti-rheumatic and analgesic, and further preventing the degenerative changes in bones, joints, and reducing the inflammation, pain, and stiffness of the joints. The rhizome, Zingiber officinale, okay, the ginger, it contains gingerol, and it is a potent inhibitor against prostaglandin biosynthesizing enzyme, and thereby it also exhibits the anti-inflammatory action. Then Piper longum, Pippali, it possesses potentially useful anti-arthritic activity, which is demonstrated in animal studies. So that's how we reach to the conclusion that Vyoshadi Gugur and Panchasama Churna are safe at the recommended dose and period of consumption and are aiding in the management of RA based on the relief observed in the Ayurvedic and modern clinical parameters, DAS 28 score, ESR, and disability index score. Thus, the intervention effectively reduces the clinical symptoms of RA and improve the quality of life. Further, large sample RCT studies may be planned to compare the safety and efficacy of these interventions with that of the standard care drugs. Thank you.
Thank you so much, Dr. Supriya. Thank you so much for this wonderful presentation today.
So much.
Yeah, it was really good to know that it was really disheartening to know that how difficult it is for anyone with rheumatoid arthritis and their quality of life is severely affected.
Yeah.
Yeah. We couldn't get to the limitations part. Do you think there are any limitations in the study, things which they could have done differently?
Yeah. So in this study, actually, they have means it is an open label study, one. Okay, and with
What
open label
exactly is
study,
an open label study?
open label study means the participant knows what we are having, what medicine we are getting.
Hmm.
Okay, so that's how yeah, there is some pre-conscious notion sometimes, or something like, so these are some of the factors which can affect you, psychologically also, like I'm getting a medicine,
So a blind
Ayurvedic.
study is more preferable
Yeah. Those
comparatively.
language studies are more, could be more helpful in, to reduce this.
Okay. Any
Problem.
other thing you feel that in treatment could have been something different and the
Yeah,
paper
maybe,
is lacking?
maybe addition of a comparator, because there was no any comparator in the study. There was only one intervention, means two medicines, but there was no any comparative group.
Yes,
So that
true.
is,
So that we have an idea that how this is better or anything or vice versa than the other thing. There has to be
yeah,
a comparative group or maybe a control group.
yeah, right.
Yeah.
Right.
Anyway, yeah. Do you have anything else to share?
Yeah, so like there have been so many studies on management of armvad, rheumatoid arthritis in Ayurveda. Okay, there are so many formulations available in Ayurveda. Like there is a rich amount of formulations available in Ayurveda for rheumatoid arthritis. And some studies, actually, there are some studies, some good studies been done by been done in Ayurveda, in which there were comparators used, as there was Basti also, and like different modalities which are useful in the treatment of rheumatoid arthritis.
Hmm.
Yeah, so a good amount of work is done in Ayurveda in case of research in management of rheumatoid arthritis.
Yes, yeah. So they could have tried something more maybe specific or different modalities to add to the treatment plan. Uh, but I think they were mostly focusing on, and they wanted to show that how like arm is causing the disease and how it can change and be more effective if you specifically work on Deepan and Pachan
Yeah,
and
yeah,
then Rasayan.
yeah, yeah. I personally believe, like uh, very simple, basic concepts of Ayurveda, just the five elements, the basic concept of Ayurveda, the five elements, or the Vat, Pitta, Kapha, the guna, the qualities of the food that we are having, qualities of the herbs that we consume. Okay, so these are like even the digestion, Agni, armor. These are such easy and simple concepts in Ayurveda, and they have, they are like proven to be, relevant still. That is, I personally like it. I love it.
Yeah, true, true, true. Uh, anyway, we are running out of time. Can you stop sharing your screen, please?
Yeah, yeah,
So, let's conclude. Thank you so much, everyone, for attending this Journal Club meeting today. Thank you so much, Dr. Supriya, for presenting today. Uh, as we conclude, please watch and subscribe to our YouTube channel to stay updated with the latest research in Ayurveda. Please like, comment, and share the videos. Once again, I would like to invite you to become a member or also become a volunteer and fill out the volunteer form. You can all now also subscribe to our IU Update newsletter to stay tuned to our projects and events. If you have any questions, feel free to contact us at Ayurveda Research USA at gmail.com. Thank you again. Hope to see you again at the next meeting. Thank you so
thank
much,
you.
Dr. Supriya.